Dr. Das. I'm a consultant cardiologist at St Bartholomew's Hospital. I'm also the CEO of Ortus-iHealth, which is a remote monitoring and virtual ward solution. We're an end-to-end remote care platform that really focuses from the entire kind of spectrum of acuity, from hospital at home to virtual wards, to actually shifting now to proactive long-term remote monitoring. And we're really trying to improve clinical outcomes, reduce admissions into hospital, and where they do come into hospital, can we get them out quickly and evidence generate that of improved outcomes and cost efficiencies for the system. So I think what's different from our solution is very ground-up, clinician-focused, built by clinicians for clinicians, really focusing on evidence and scalability. The same solution can be used for your entire long-term conditions, and that same patient in a long-term condition can flex up and down their acuity, be it their virtual ward or hospital at home, all with one solution. It's flexible and scalable such that patients can have a software-only solution, or they can use their own home devices or wearables, or where those who don't have them, we can provide them kits with the logistics. What that allows a system to do is have not a one-size-fits-all for them, really bring your cost per patient down and increase the utilisation of remote care to your entire patient cohort. It's a really interesting day, a really great day to see colleagues in the same space. It's really interesting to see how services are now becoming more mature. They've set up pathways, looking at what works, what doesn't work. A key feature that I'm seeing, especially from presentations, is now that we're going to have to evidence generate that the pathways that we have set up both produce clinical outcomes, both are cost effective, and then really choose what services work and how can we scale those services. I think the key challenges is funding now and showing outcomes and choosing the pathways that have those outcomes and benefits. Funding. I think the challenge certainly for remote care and in healthcare as a clinician, frontline myself as a clinical director of a service, is funding. How can we really continue, especially with remote care, with 1 year non-recurrent? We really need to try and set aside some money that we can proactively do this with a clear line of sight, that we have 3 or 5 years to really deploy this properly with a clear funding site. What I would like really most NHS leaders to really look at the entire spectrum from acute care down to proactive care, and really look at their digital solutions and allow to traverse that entire spectrum easily for their patients, and also best of breed where they have solutions that work with their electronic patient records, make them interface so there's one seamless experience for both clinicians and patients.